and welcome to the new edition of Dr. Lamba's Awakening Call. Every 5 years, Government of India conducts National Family Health Survey, and that gives a snapshot of gender, of health, of population, fertility rate, malnutrition, and so on. And this fifth National Family Health Survey is quite revealing. As a matter of fact, it brings forth certain issues that have been ignored. Some are good, some are bad and ugly. But on the whole, it shows that the policy of the Government of India and the people of India needs to change. Most important, too much of talk about India being overpopulated has proved to be incorrect. It is overpopulated, but the population is not growing the way it was thought to be growing. Now, you'll be amazed to know that India's total fertility rate, TFR, that is the average number of children born per woman in the total reproductive time, has dipped below the demographics. The health professionals, they have thought that if the replacement rate is 2.1, then the population remains static. But in India, in this report, it is revealed that the total fertility rate of the average number of children born per woman is now below the replacement level. Meaning thereby, the time may not be far off when India resembles countries like Europe, countries of Europe, Germany, Sweden, Denmark, Norway, even England, where TFR is much lower. But then there's an interesting conundrum in Europe. While the TFR, the fertility rate of the natives, is much below the replacement level, there are huge number, a large number of immigrants who breed like rabbits. No, I'm not blaming rabbits, but that's a fact. Now, coming back to India, we have always been thinking that there are less females and more males. The census of 2011 finding stated that for every 1,000 males, there are 900 females. And this survey again gives a number which shows that women are more than men in India. So the census figures, they are not wrong, but then they have been changed. 10 years is a long time. The next census is due next year, 2021. Then maybe the results of this health survey shall be confirmed, because health survey and census survey, they are the most dependable reference points. Now, you would be amazed and interested that women outnumber men. For every 1,000 men, well, the census says there are 940 females. According to this survey, there are 1,020 females. So 20 females more than men in a group of 1,000 men. So the fresh census data might yield, as I said, a very conclusive result, because this is amazing that on one side we have men outnumbering women, and the survey says, no, that's wrong. Then another thing which is amazing, that sex ratio at birth, which is a very important point, is still skewed towards the boys. Now this is something contradictory. If more boys are born than girls, how can there be more women than men? Something is wrong somewhere. Whether the figures have been juggled or whether they are typographical errors, whatever. It doesn't sound sensible. Now, another thing which is important is that these leaders, netas, political leaders who keep flagging the population explosion bogey, should now start thinking on focusing on job creation. Now you will be asking me why. There are three states, UP, Bihar and Jharkhand, where unemployment is maximum and the growth rate, the replacement level, the total fertility rate is higher. While in the whole of the country, total fertility rate is less than 2.1. In these three states, it's more than 2.1. Meaning thereby that when the people are unemployed, the only employment they can have is sex and have more children. So a vicious cycle is built, more children, more needs, more unemployment, more poverty. Now great strides have been made in educating the girl children, shows to some extent how the things have changed. This is something extremely important and it should be a telling point to Taliban and to Pakistan. It shows that if the girls are more educated, there will be national shift of the demographics. Between 2006 and 2018, a period of 12 years, girls out of school between the age of 11 and 14 fell to 4.6 from 10.3. So there was more enrollment of the girls than it was earlier. Now, girls between the age of 15 and 16 not enrolled in school dipped from 13.5 from over 20%. So that decrease in the number of the girls who were not attending the schools. And women aged between 15 and 19, pregnant and already mothers, declined in this period from 16% to 6.8%. So if the girls are educated, they receive education, then they will not be married. And if they are not married, they will not produce children. And if they don't produce children naturally, the fertility rate comes down because the puberty starts at 12. So if you marry a girl at 12, and there have been instances, but even if you marry them at 19, basically they should be married at 21. But then we have seen it. Now, another very interesting thing is that the women are gaining autonomy. They are becoming empowered. This is an excellent news. The gender parity is coming. Would you believe that the indicators which are there show that the women are now becoming assertive, empowered, and capable and independent? In 2015-16, the last survey that was conducted, the fourth survey, National Family Health Survey, only 54% women had bank accounts. In a period of 5 years, the women having bank accounts has increased from 54% to 80%. This increase is momentous. It's almost a little less than double. that if the women have more bank accounts, they are financially independent, they are not dependent on the males for their day-to-day needs, and they can be independent and not be sex slaves. Now, another thing, at that time only 46% women had mobile phones. Now 54% have mobile phones. And still more important, at that time only 57% women had menstrual equipment like sanitary pads and sanitary napkins and things like that. Now 77%. So from 57 to 77%, and that means more hygienic methods, which are health giving, which protect them against infection, and so on. But there's another thing. Though they have more bank accounts, though they have more mobile phones, though they are using better hygienic methods, yet their economic situation has not improved much. Women who reportedly working in the last 12 months rose marginally. In the earlier survey 5 years back, 25.4% were working. Sorry, this survey. Earlier it was 24.6%, so an increase of 1%. While the number of bank accounts has increased from 54% to 80%. That's almost 60%. Here the increase is only 1%. Then another very worrying fact which is revealed is that the health insurance coverage has reached only 41% of the household. Now in a country which is 1.3 a bit more than that, only 41% has the health insurance. The number of anemic, weak women and children is also shocking. In the last report, that is 15-16, it was 67% of the children and 60% of the women under 60 who were anemic. Now the global average is 33%. Indian figures are almost double, rather absolutely double, from 33% to 67%. Now this shows two things. One, malnutrition. They are not getting healthy food. And that also shows India's food security and nutrition supplement schemes are not as successful as claimed by the government. Now, there's another thing. In the last survey, we saw that 78% got institutional birth. The children were born in the hospitals or the proper. Now only 88% are born. So that shows that community and the district hospitals are no more accessible to the people. But a functional public health system that removes out-of-pocket spending on medical needs is a cause of people slipping into poverty. More people go to the hospital, which are mostly private, they have to pay. Now, another thing which is coming up is that there is rising obesity, lifestyle diseases, and they are not being addressed. As I said, malnutrition leads to obesity and weakness and susceptibility to disease. Now, there's another aspect which we often ignore and all the policymakers ignore. Steadily falling TFR, if the total fertility rate is reduced, that means the replacement level is reduced. What will be the result? There will be more aging population as is in Japan, as is in Europe, as in Canada. And there will be greater morbidity burden because there'll be focus on the public health of the seniors. So, more seniors, there's a more care, more expenditure, and the real needy required youth would be ignored. So the larger measure is the resources that the state and the household provide for better and healthier living will not be there. Now the results released last Wednesday affirm these things, that okay, our TFR has fallen down, which shows the average has come down to 2%, it's at 2.3%. So it's a major demographic milestone. And that is why we need not bother about that. But we have got to see that the geriatric population doesn't increase. A 9% increase in the use of modern contraceptives as compared to the last survey also indicates that the family planning programs are now a bit more successful. And that again is a positive sign. One thing I like to point out, that in 2016, the program's stated object was to give special attention to the high fertility districts in Bihar, Uttar Pradesh, Assam, Jharkhand, Madhya Pradesh, Rajasthan, Jharkhand. It was done. But why is it that the three states of UP, Bihar, and Madhya Pradesh have not been able to address the bogey of overpopulation? That's something major. And despite the varying political affiliations, let's not bother about that. We have got to realize that a growing population, especially at the geriatric level, is extremely harmful because it puts the country's resources under a huge restraint. And there is a lopsided utilization of that. There is much sobering about it. Just saying that our fertility rates have come down, there are more bank accounts, there are more mobile phones, and everything is fine. But 57% of the women being anemic, and while it was 53% in the last survey. So the health of the women has become worse. The percentage of the anemic children is also increasing. So what sort of a population we'll have? We'll have anemic adults, the young population. So the olds are already bad, they are a burden, and the younger generation which comes would also be a burden. Now, last survey, the fourth survey, had surprised experts with the finding that, now I'm coming to the economic thing, that 34% women owned a household jointly or individually. This has risen to 43.3% now. So more women have their own houses. But do they have their real own houses, or are they just joint owners? States like UP, Chhattisgarh, Jharkhand, Punjab reported huge improvement in women ownership of the houses. UP, for example, increased from 34% to 51%. Delhi reduced from 22% to 22% from 34%. So it's amazing that in a place like Delhi, which is highly educated a capital, the house ownership by women should reduce. So isn't that ugly? But it doesn't show one thing. And that is, how has the path-breaking 2005 Hindu Succession Act, which gave women more powers, more economic wealth, gave daughters equal share in the undivided joint family, where is that going? Is that really successful? Today, only 27% women claim property ownership. And that is something which is worrying me. The data gaps are not fixed. Let's be very clear. So, although in parts the health report gives a very rosy picture, there are very, very dark spots. But one thing is sure, that the Indian model has proved to be better than Chinese model. It has diffused the population bomb without cohesive contraception or one-child policy. Number of children per woman has dipped, as I said below, and that just is important. Now the point is, it should not fall more, and the women's health and economic independence should be taken care of. So, this report should be taken with a pinch of salt at one level, because there are data gaps. And some of the data gaps would be removed when the census report comes. But on the whole, we have got to see that TFR doesn't fall down, but the nutrition and the economic independence of the women doesn't suffer in any way. If that can happen, that will be a real revolution, and maybe the beginning of what Modi would call it Achhe Din, the good days. Let's wait and watch. Thank you.